Hi, Dr. Clark Britton again. Today we're going to discuss an issue that's related to men's intimate health care. You know, as an aging man, I myself have been paying attention to this too. And, you know, with the aging process, several things happen that are natural. We get a little grayer, we get bald, sometimes we get a little bit of a paunch, our muscles aren't quite as strong. We aren't quite as nimble, we're not quite as athletic, sometimes our balance is affected, sometimes we aren't quite as sharp with our memory or calculations and so forth. Some other things that happen that are a little more distressing for some of us include a loss of erectile function, and it's called ED or erectile dysfunction, where the penis can't get quite the erection it did when we were 20 years old, or with the frequency or the intensity or have the duration of effect that we had at our younger years. Now this can be a natural, normal consequence of aging, and couples get over it. A couple may find that both partners are less functional sexually as they age, and they're plenty happy with that. What I see in my practice of people come to me with requesting assistance is that the male is not able to keep up with his partner. And that can be pretty disturbing. It can affect the relationship because intimacy may only take a few moments out of a 24-hour day or a 7-day week, but it's a huge impact on the quality of the relationship and the intimacy that endures beyond those few moments of that special time. And so that can affect not only the relationship, but the man's self-esteem, work performance, attitude. And there's a number of factors that go into the process of erectile dysfunction. Now, this can be because of the natural aging process and a decline in collagen fibers in the penis itself, lesser blood supply to the organ. Our testosterone levels tend to decline. Women have a hormone history that looks like this: childhood, puberty, reproductive years, perimenopause, and menopause. Men tend to do this: childhood, puberty, reproductive years, andropause. That's a little more subtle change, but by the time a man hits 60 years of age, they frequently lost 60 or 70% of their testosterone level, which is a key element in being able to obtain and maintain an erection. Well, also along with that include vascular changes, and I mentioned collagen, and there's some exciting things that we can do to help all of this. Well, when we see a man in our office who's saying, "Doc, I'm not able to perform the way I used to, and I can't keep up with my wife, and it's tearing me up." So there's some really simple things that any man can do right now to improve their erectile function. So we know that exercise is huge. Men who exercise regularly, aerobically and resistance training, maintain better erectile function. We know that diet and sleep habits play into that. There are certain dietary supplements that seem to help a lot. CoQ10, vitamin E, arginine, for instance, and you can get those over the counter. You can have special diets that include those. We know that any kind of sexual stimulation can help. We know that maintaining hormone balance is a really big deal. So a lot of men, as the testosterone level starts to decline, they get to a certain threshold where below that they lack mental clarity, they can't focus, they're not maintaining their strength and endurance and so forth. And so we look at that. There's a couple other things that we do specifically in our practice that a lot of other practices don't do and aren't aware of. Number one, we're using hormone pellets for our men, which is a technique that's been around for a really long time. Sotopelli is what we use, and it's been around since 1939 or so, where subdermal testosterone pellets get placed underneath the skin to allow a gradual increase in testosterone levels, and then it's maintained over time, that allows one to be a little stronger and so forth. And it can frequently help with the sexual functioning. Another thing I did and do in my practice, and I just had an experience this last week that was pretty exciting about this. You've maybe heard of Viagra and Cialis and various medications like that. I had a gentleman come to me recently who was distressed about erectile function, had not had an erection in 7 years, and he and his wife were doing some other things to try to maintain some sexual intimacy for themselves, but he could not get an erection. He took 2 doses of Viagra and had 2 erections and ejaculations in a week that he had not had for 7 years. This guy was dancing in the streets, so to speak, and we hadn't even gotten to the testosterone part of his therapy. So these are small things that can help a lot. Testosterone is a really big deal. And then another thing that we do that is relatively new is called a P shot. P being an abbreviation for Priapus shot. Priapus was a Greek god of eroticism and virility. And a brilliant doctor in southern Alabama named Charles Runnels came up with the O shot, which I've discussed in previous interviews, and I'll go into a little bit here in a minute. And then he also developed the P shot for men. Well, what that is taking advantage of your own natural healing properties. So we take a tube of blood from your arm, we put it into a special FDA approved vacutainer, spin it down in a special FDA approved centrifuge, and then we extract the supernatant, which is the plasma that contains the regenerative cells and platelets, and then we infuse them into the penis itself. And we find that by doing that, we can increase length and girth and erectile strength, and it even stimulates libido. It sounds like a pretty crazy thing to do, but you know, guys have been using trimix and bimix injections to put into the penis to obtain erections for a lot of years, and this is a very painless process. And just to make sure that it's not painful, we numb up the penis before we put this in. In conjunction with the P shot, we do what's called shockwave therapy. As I mentioned, as time goes on and our testosterone levels decline, we find that the collagen concentration in the tissues has diminished. There's adhesions, and we use this shockwave therapy to complement the P shot, and that helps stimulate the production of new blood vessels, decrease the incidence of scar formation, and it works in conjunction with the PRP regenerative cells and platelets to enhance the quality of erections. Another thing that we see in men is a painful curvature of the penis called Peyronie's disease. We don't know for sure exactly why this happens, but it's suspected that it's from micro trauma. Could be an autoimmune process. So that instead of the penis being nice and straight, there's a curve, and that curve is associated with a scar formation that prevents the penis from being straight. And that curve, as the penis starts to get erect, it causes a stretching and a pain, and a lot of guys find they can't have an orgasm because if they do, it just hurts like crazy. Well, the same doctor, Dr. Runnels, who developed the O shot, found that if you inject that PRP solution directly into that plaque, particularly if you also employ this shockwave therapy with it, after a couple treatments, most men are able to resume natural function, which is just nothing short of miraculous. I'll mention the O shot once again, just so that you don't think I'm leaving you hanging. And I mentioned this in a previous episode, but the O shot is a similar process for women. Same tube of blood, well, it's individual's own tube of blood. It's spun down and then injected into the body of the clitoris and underneath the urethra, between the urethra and vagina. So if here's the vagina, here's the urethra, it goes between these two planes here, so that it comes in here, it affects the G-spot for sensation, the urethral sphincter for bladder control, and into the clitoris for sexual sensation. We find that by doing that, again, after everything's all numbed up and the patients don't feel this, we get about an 80% improvement across the board in orgasms, and bladder control. So again, the P-Shot has been around quite a while now. More and more doctors are using it. There's some prominent urologists in the South and the East Coast who are doing this. Some call it shockwave therapy, some call it Gainswave therapy. It's going to become the standard of care for Peyronie's disease, and it often complements erectile dysfunction. But just to summarize, erectile dysfunction can be a natural consequence of age, but many older men maintain erectile function and sexual functioning if they do these simple things. Exercise, don't smoke cigarettes. I didn't mention that earlier, but tobacco is a killer for a lot of things. Avoid diabetes, so don't get a big belly so that you got to take diabetic medication. Diets that include lots of supplemental things that are micronutrients like arginine, CoQ10, vitamin E. And then the aerobic exercise and using the sexual organs as much as possible for that stimulation. You don't have to live with erectile dysfunction. Many things can help many men. There are some conditions that probably don't respond very well. So we can't make a large penis out of a really small one. We can't return or reinforce or have a return to normal function of an organ that's been affected by type 1 diabetes for a long period of time because of the microvascular changes that occur in type 1 diabetes actually inhibit the flow of blood to the organ. And then finally, there's one other simple thing that can actually help, and this might sound kind of crazy, but imagine that you're standing at the toilet emptying your bladder. You can simply do a stretching maneuver of the penis in all the directions, and that can also help stimulate the same kinds of things that happen with shockwave therapy and the P-Shot. In conjunction with the P-Shot and the shockwave therapy, we're using a penis pump, and that's a vacuum device that creates an artificial erection, if you will, using just a plain vacuum tube. And we find that you can increase the size of the penis and sometimes the blood supply just using the penis pump. And again, these things are designed to help one maintain or regain, if you will, sexual functioning, the return of the intimacy of a relationship that might desperately want to have it, and to help with self-esteem and overall health. I'd like to help you if you're interested. You know how to get a hold of us. I'll talk to you later. Thank you very much.